Hey guys, it's me, Ree. In this video, we're going to be looking at the autonomic nervous system. Now, for those of you who have had me in previous tutoring sessions, either in Neuro 1, Neuro 2, or in Part 1 boards, I have gone into far detail in the autonomic nervous system. And you guys should know I love teaching the autonomic nervous system. But today, I'm going to really simplify it and look at the main points that will be kind of questions on boards. So there might be a lot of information on this page and on these 2 pages for autonomic nervous system, but note that I will be highlighting the main ideas. I hope you guys know all of it, but we're trying to study for boards, so I understand. So with the autonomic nervous system, there are 2 divisions, the sympathetics and the parasympathetics. The sympathetics is that fight or flight response, right? Tiger's coming at me, I'm going to fight back, or tiger's coming at me, I'm going to run away like a little girl. Parasympathetics, rest and digest, okay? This is sipping wine and dining, okay? And when we look at these 2, instead of our normal primary cell body, secondary cell body, tertiary cell body, like we see in other tracks that you've discussed throughout neurology, with this, we have 2 different types of nerves. We have preganglionics and postganglionics. So a ganglion is a group of cell bodies outside of the central nervous system, within the peripheral nervous system. A cell body, right, our nuclei, those ones are going to be within the central nervous system. So our preganglionic is before the peripheral nervous system, and our postganglionic is within the peripheral nervous system. Okay, so let's just draw it out for a second. So I have cell body here. We'll use this diagram, okay? So right here, just to give you guys orientation, this is my brainstem. Right here's my pons, here's my medulla, and then here's my spinal cord. So sympathetic-wise, sympathetics are only found from T1 to L2. This is why, depending on the theory, right, we talked about a couple of theories. So think about the neurodystrophic theory. Neurodystrophic theory is saying that a stress causes a decrease in immunity in the system, which will then increase sympathetics, and that sympathetic increase will cause subluxation, or will cause a restriction. And so that restriction then, with that theory, would be from T1 to L2, somewhere in there. And when someone is sick, a lot of the time you'll actually feel on your patients, yes, that is an area. If someone's tense, yes, it is in that area. Specifically in those upper thoracics, right? So from T1, T2, T3. Reason for that is coming out from T1, T2, and T3, it comes into our superior cervical ganglion. So it's going to be the ganglion that are associated with basically our shoulders and up. And a lot of our stress is held in that area and is highly innervated in our more cervical region rather than the lumbar plexuses. Anyway, long story short, what I'm saying is right here where you see in here at the IML from T1 to L2, that is my preganglionic of my sympathetics. Then they're going to eventually synapse at a ganglion, whether that's my superior cervical ganglion or whether it's down here in my prevertebral ganglion. Whatever the ganglion is, its synapse is there, and it will then become the postganglionic, which you see in the green here. Now, in previous videos where I talk about autonomics, I go through the 3 different options a sympathetic has, right? It has the white t-shirt option, it has the traverse, let's go for a walk option, and then it has the adrenal panic option. I'm not going to go into those here. If you want to know more about that, you can ask me and I can send you that video. But for today, I want you to just understand the idea that we have a preganglionic from T1 to L2, and there's a postganglionic after the ganglion. The other thing I want you to note is for the body walls, we go through what I call the white t-shirt theory, which I have kind of drawn right here. So the white t-shirt theory is essentially like a girl going on like summer vacay, right? You come in, you go on vacation, you go to summer vacation wearing a white t-shirt, but a lot of things happen. You see some people, you interact, now you're postganglionic, and you're leaving with a gray t-shirt. And that's because when our IML, when that preganglionic comes into the ganglion, it's going to enter through the white rami, or the white t-shirt, and then it exits through the gray rami, or the gray t-shirt, right? Because things happen inside that ganglion that you don't need to talk about, but now it's a gray t-shirt. So that's how I always remembered that white rami communicante is what I'm coming in on, and gray communicante is what I'm leaving on. So this is the pathway that most sympathetics go through. This is the pathway to our body walls. This is the pathway to our skin, everything like that. There are a few things that go through a different pathway, and this is the one I say take a walk pathway for sympathetics. And the take the walk pathway is going to enter in through the white rami communicante. So you still need to know that. But then it's going to say, you know what? I'm not into partying right now. I'm going to take a walk. And so it takes a walk through the splenic nerves. And there's a bunch of different terms for the splenic nerves. I have them listed here if you want to know those. I doubt, 100% doubt that will be on boards. Knowing splenic nerves is important, but you don't need to know greater, lesser, least, or lumbar and what associated levels they are. But if you want to know, they're here for you. But it takes a walk on that splenic nerve until it reaches something called the prevertebral chain ganglion. And there's a couple of different types of prevertebral chain ganglion. There's the celiac ganglion, the superior mesenteric, inferior mesenteric ganglion. But these ones are not as close to the vertebral column as our sympathetic chain ganglions are. So it's a little farther out. And this is going to send information, or it's going to send those post-ganglionic fibers to our viscera. So this is our sympathetic response to our viscera. So this is going to be why my stomach, when all of a sudden I'm in this fight or flight, now my stomach is getting tense and all doesn't feel very good and I'm not digesting correctly. And now I have constipation. You're like, oh my gosh, what's happening to myself? That is all associated with this take a walk pathway for sympathetics. So sympathetics are pretty easy, right? I'm IML, T1 to L2, and then to a ganglion, post-sympathetics. The signals that it sends. So my preganglionic sympathetics are going to release, I think I have it right here, are going to release acetylcholine. And my preganglionic sympathetics are going to be very short, right? They're just going from the IML to the sympathetic chain ganglion. Very short distance. My postganglionic parasympathetics are very long. And they're going to release, for the most part, epinephrine and norepinephrine. There is only one case where it releases acetylcholine, and that is to our sweat glands and our blood vessels. So don't worry about that too much. But for the most part, it's epinephrine and norepinephrine. Epinephrine can bind both to an alpha and a beta neuropeptide. Norepinephrine only goes to alpha. What alphas do is alpha excites smooth muscle. A beta inhibits smooth muscle. So when you think of smooth muscle, just think of basically any visceral organ you can think of. So I like to think of the intestines, because that makes me think of, am I going to the bathroom or am I not going to the bathroom? Is food moving or is it not moving? So if I have epinephrine sent out, epinephrine can do both inhibit it and excite it, which means I can modulate it better, okay? So epinephrine is more modulatory. Norepinephrine is like move, go move. So norepinephrine, if I'm just sending norepinephrine, it is just moving stuff through that smooth tissue like you've never seen before. That smooth tissue, the smooth muscle like you've never seen before, okay? That's when you're like, I gotta go to the bathroom right now. So nori is right now to the bathroom. Epi is a little bit of both, a little bit of this and a little bit of that. Now, the beta aspect of epinephrine is targeted by beta blockers. So that's what beta blockers do. Beta blockers are going to stop the inhibition of smooth muscle and cardiac muscle. And that's why it's used for people that have heart issues where the heart is stopping, right? If I block that beta reception of the epinephrine, now all I'm doing is I'm using alpha reception. And alpha reception excites things, and we want to keep the heart going. We want to keep going so we don't die. So that's how beta blockers work. The problem is we still need a little beta in order to control things. So now people might get hyper because they have not enough beta. I've said a lot of words right there. Take a breath. All right. That's the rundown in this little picture right here. See, it's literally like a little square box. Is everything I just said right there. Memorize that. You're good. 2 more things or 3 more things about sympathetics before I move on to parasympathetics. There's 3 different words that you might see: vasomotor, pilomotor, and pseudomotor. Vasomotor is the idea that blood is shunted to large muscles. Wherever blood goes, muscles will move. Wherever blood goes is where the signals will occur. Where excitation occurs is where the blood is. So the idea of vasomotor is that, like I said, sympathetics control our blood vessels. We are shunting, so you can decrease right? And close or constrict, vasoconstriction can occur in areas where there's small muscles so that it can be sent to our big muscles. This occurs when we are in a sympathetic state for two reasons. One, when in doubt, if I have a lion coming at me, I would much rather use my hips and my shoulders to run than I would my fingers and toes to write a note to the tiger and ask it not to kill me, right? So I want to use my big, large muscles that are going to do my big gait movements, which, when running away from predator, is moving my arms and moving my hips in order to run away. So it's kind of a survival tactic of going to the larger muscles. And for the most part, all of our larger, actually, for all of the parts, our larger muscles are found in our rhizomelic areas, so right, our hips and our shoulders, as well as in our core. So our smaller ones, more intricate, delicate, the ones doing fine motor movement, is all in our hands and our feet. We say, all right, let's not send blood there, let's shunt it to the large muscles. So that's vasomotor reaction. Pilomotor reaction is a lion's coming at me and all of a sudden you see my hair is standing up. So pilo is just talking about the erector pilae, which are these little motor muscles, motor units that we have within our skin, within our epidermis, and it will cause hair to stand on end. And that's, if you think about it, you get scared and oh my gosh, your hair stands on end. That idea is just a pilomotor response. The last one is pseudomotor. And so pseudomotor is for sweat, and we sweat profusely when we're scared. Now, I like to think of it pseudo. I think of like a pseudo wrestler or something like that, right? And they're big, fat, and sweaty men for the most part. And so that's how I remember that pseudomotor goes with sweat. Now let's talk a little bit about parasympathetics. Parasympathetics are kind of the opposite of sympathetics. They are going to be that rest and digest, but also in their structure, they're a little opposite. So the preganglionics with parasympathetics are long. They go on for days, okay? So their preganglionics are super long. They release acetylcholine, and their postganglionic are very short, and they also release acetylcholine. So parasympathetics is just acetylcholination. Now, if we look here, parasympathetics we can find with cranial nerves 3, cranial nerve 7, cranial nerve 9, and cranial nerve 10. Right here, I have all the specifics to it. If you want to know that, I doubt on part 2 they'll get into these specifics. That's more of a part 1 thing. But it is important to know 3, 7, 9, and 10. Here is kind of drawn out all of the places. But just to remind you, cranial nerve 3 in relation, it starts at the Edinger-Westerfeld nucleus, and it travels along the ciliary ganglion, and it's going to go to the intrinsic eye muscles. Right? It's going to cause that constriction to occur. 7, our facial nerve, is going to have sympathetics starting at the superior salivatory nucleus. And it's going to go to 2 different things, the lacrimal glands, the serous mucus glands, and the submandibular and sublingual glands. So all of those things are my tears and my saliva. So I like to think of the facial nucleus kind of like what happens when the guy breaks up with you, right? You want ice cream, so you're salivating. And you're also crying, so your lacrimal glands in your nose are really going. So that's facial nerve is basically the parasympathetics for when you get broken up with. Cranial nerve 9 is going to originate at the inferior salivatory nucleus. It's going to go to the otic ganglion and all that jazz, and it's going to go to the parotid gland. Parotid gland in the back of the mouth is also going to be saliva, but this is like the big saliva producer. So this is not so much like, oh, I'm crying because he doesn't like me, I just want to eat ice cream. This is more so like, I am just always hungry and I want that freaking burger. That is what cranial nerve 9 does. So it's that big saliva producer. 10, vagus, is going to start at the dorsal motor nucleus, and it's going to send things to the thoracic and abdominal ganglion, parasympathetic ganglion chains, and it's going to go and work in the enteric system. So enteric is kind of our autonomics for our gut. And so this is how we get hunger, not hunger, movement, not movement, and all that jazz in relation to parasympathetics. We also have parasympathetics that start in the IML from S2 to S4. S2, S3, S4, keep the penis off the floor is kind of a saying that you hear all the time because these sympathetics, or rather parasympathetics, are going to the descending colon, sigmoid colon, and pelvic viscera, and for men is going to the penile tissue. With this, it's important to note, and this has been a question in the past, so that's why I'm bringing it up, that for males and for females, parasympathetics is what needs to be there in order for them to function properly. So for that, you can't be thinking you're going to die in order to actually perform well. And that's the reason why if you have alcohol sends you into a sympathetic state, and that's why some people will have erectile dysfunction while they're under the influence of alcohol, because it puts your body in a sympathetic state rather than a parasympathetic state. I just ruined all of your guys' drinking times because I made it all sciencey. But that is what's going on here. So in my little picture, you can just see what you need to know: long, preganglionic, short, postganglionic. And that is my really brief autonomics. You guys know that I usually go on for days about autonomics, but that is all I'm going to give you guys today. If you have more questions, please let me know. If you want to see my full hour-and-a-half lecture on autonomics, just message me and we can talk about how to get you access to that. But until then, I hope you guys have a great rest of your day. And in the next video, we're going to be looking at the neurology behind pain. See you then.